Welcome everyone to Leveraging Data for Action. This is an English with Spanish translation webinar, training and speaker panel. We're really excited that you're all here. If you can put your name and organization in the chat box to introduce yourself and let us know who's in the room. We're happy to welcome you all. So my name is Eva Holt-Restmore, and I am joined by Sarah Adler. We co-manage DataShare, the information platform for action here in Santa Cruz County. So if you don't know about this platform, it is an interactive data platform with local, regional, and national data available to all. And we're joined for translation support by Stella Lerman, Gisela Carrasco, and Yasmin Sanchez. So thank you so much. We're very lucky to have you. We're going to do just a very brief overview of managing the Zoom interpretation buttons provided by Nicole Lezen.
Welcome everyone. So just quickly, in case you missed this beforehand, if you click on the globe icon on your control bar in Zoom, that will let you select a language channel, English or Spanish. We encourage everyone to do so. If you choose the Spanish channel, please mute your original audio so that you're only getting one feed at a time. There's also a reaction button that lets you raise your hand, give us a thumbs up, ask people to speed up or slow down. There's a live transcript button in case you'd rather read than listen. It's only in English at this point, but you can turn it on and off at your pleasure with that click right there on the closed caption button. And then there's a chat button. That's the best way to communicate with us or with each other through the chat function. And just use *9 to raise your hand by phone if you want to ask a question or have a comment. So thanks everyone. Let's get started.
Here we go. Great. Thank you so much, Nicole. Really appreciate it. And like I mentioned before, we're so happy to have everyone here, especially our guest speakers who will be talking about their experience with leveraging data for action. Keisha Browder from United Way of Santa Cruz County, Nicole Lezen from Cole Communications, Nicole Young from Optimal Solutions, and Jason Borgen from the Santa Cruz Office of Education. And I will actually hand it over to Keisha to start with self-introductions.
Good afternoon, everyone. It's a pleasure to see all of you here. I'm really excited to see just the diversity in our chat as you're putting your name and where you're from in here. So thank you again. I see a lot of our county and other nonprofits represented. Thank you for being here. My name is Keisha Browder, and I am the CEO of Your United Way here in Santa Cruz County. And I will be sharing how we are leveraging data for action by partnering with DataShare Santa Cruz County. Thank you.
Thank you, Nicole. Can we hand it off to Nicole? Thank you.
Hi, everyone. I'm Nicole Lezen, and I'm one of the co-facilitators of the Collective of Results and Evidence-Based Investments, or CORE, along with, I'll pass it over to Nicole Young.
Nicole Young, the other consultant for CORE, and I work with a number of other organizations, and I'll be sharing how some of those agencies have used DataShare for their own programs and initiatives.
Good afternoon, everyone. I'm Jason Borgen, Chief Technology Officer for Santa Cruz County Office of Education. We've been a partner with DataShare Santa Cruz and together with many of these wonderful community-based organizations and agencies supporting DataShare. Our focus is supporting educators with DataShare and finding implications around how educators, students, and teachers from near and far can use DataShare around bringing local data from our community into the classrooms and schools to make sound decisions. So you'll learn a little bit about that throughout this afternoon. Thank you. Eva?
Thank you. Welcome. So excited to have you all here. So just to run everyone through the course of today's 1-hour call, I'm going to just walk through a little bit what DataShare is for those who are less familiar. Then Sarah's going to help with some navigation of the platform if you're a new user, and then we're going to get into the meat of the conversation with our wonderful speakers. So, like I mentioned, DataShare is an interactive platform. It's been the central hub of data and information in Santa Cruz County since 2019. We have on the platform more than 350 community well-being indicators. These really help us tell the story of our community strengths and gaps. And it serves all different kinds of communities and community members, from funders to concerned community members and public servants. This information is available to everyone for free. We have some main tools on the platform that help us kind of leverage that information for the well-being of our community. These include powerful reports, local progress, some relevant data to your particular project or the community which you serve, and then dashboards that help us visualize that information in the most useful manner. Each of these tools we'll kind of talk through a little bit today with the stories of our speakers. And I will hand it over to Sarah.
Hi, all right, I'm going to share my screen. Okay, so this is the DataShare Santa Cruz County website, and our URL's up here. So just to start off, if you want to translate it to Spanish, there's two options. You can go up to this Translate To button and go to Spanish. And this is what we recommend because as you navigate around the site, it'll stay in Spanish. But if you just wanted to translate this homepage, you could just click this button here and the homepage will be in Spanish. So to start off, there's a couple ways to search for data on the site. And the two main ones are using this Search This Site button at the top. Or if you scroll down the homepage a little bit, you can search for data here. So type in a couple keywords and you can find data points that you're interested in. Coming back up, this is our navigation bar. So we have information on data, hot topics, which are focus areas with indicators around a certain topic. Local progress, so you can come here to look for data on what different initiatives or organizations in the county are working on. Resources, so we have like the CAP report, birth report, other more national resources as well, but local ones too. And then About Us just has information about the site. If you stay up in data and you want to kind of just get a briefing of what's on the site, there's some quick tutorials here. I think they're each about a minute long, and they'll walk you through how to go through the site and teach you how to interact with data on the site. Scrolling down a little bit further, we have this middle section here that can kind of direct you to what you're looking for. So if you're interested in seeing indicators, so those are just data points on the site, we have over 250 and you can click that here. If you want to focus a little bit more on a specific topic area, we have focus dashboards. So a dashboard is just has a bunch of indicators related to a topic. So if you're interested in health and wellness, you could click through that dashboard there. If you want to see demographic information, so if you're writing a grant or need to put something in a report, we have demographics on Santa Cruz County. Some of our featured resources, so these might be local resources or ones we want to highlight, you can find here. There's also funding opportunities, so these are at the state and national level. And then we have a community calendar. So now we're going to take a second and do a quick little exercise. So I want you to search on the site for an indicator or report about food insecurity. So we went through a couple ways that you can search for data on the site. And so I want you to search for food insecurity. And when you find an indicator or a report or any information, just throw that in the chat. Great, so I see an indicator here from David Davis, a couple Davids. On projected food insecurity rate. Awesome. So yeah, so one way to do this would be to type food insecurity in this search function, this button up here. You could have also gone and searched here in this search bar, or if you wanted to kind of get a broader overview of food insecurity, you could have looked through health and wellness and looked for indicators around food insecurity. Thank you. Someone else mentioned if you go to Hot Topics, we have stuff on food insecurity right now. And there's also a couple of resources and reports on food insecurity. All right, and I'll pass it back off to you, Eva.
Great. Thank you so much, Sarah. So we're always looking for new data and trending data. If there's a hot topic that you think should be there and isn't, please let us know. We're super excited to welcome Keisha and her story of using data for action. And I will just hand it right off, Keisha.
Okay, I'm multitasking. Thank you, Sarah, for having that quick exercise. As I put in the chat, there's no wrong door to finding data on DataShare. So that was, if you walk away with anything, walk away with that, knowing that you can always access data in a variety of ways on DataShare. So my story is really about what United Way did to partner with several other organizations here in the community to form the Black Health Matters initiative. So this initiative really came out of both COVID and the racial uprising that we were witnessing and unfolding last spring after the murder of George Floyd. And as we were coming together as a community, we wanted to get a better understanding about the quality of life for Black and African Americans here in Santa Cruz County. And what we found was that there was limited information, limited data. Of course, being as United Way as a partner with DataShare Santa Cruz County, and the fact that for 25 years, United Way has partnered with Applied Survey Research to conduct the Community Assessment Project. You may know it as CAP. It was just eye-opening to discover that there was limited data on the Black community here in Santa Cruz County. But that's the beauty of DataShare, is that we can amplify our voice and call that out and make change. So with Black Health Matters, United Way partners with the Tannery World Dance and Cultural Center, Blended Bridges, NAACP, and County Park Friends. We sat around and said, how can we learn about the quality of life for Black and African Americans here in Santa Cruz County? Where do we start? How do we get out? What does access mean for our community? And so as we started to look at the research that we did have, we noticed that when it came to demographics, the Black African American community was categorized as other. So we were put in this category, probably, most likely, because there's less than 2% African Americans here in the county. But the thing about othering, the unintentional consequence about othering, is that you lose a sense of identity. You lose a sense of knowing who's truly in your community, and how do we make sure that those in the other category are accessing the programs and services that so many of our amazing community-based organizations provide in this county. So just discovering that being othered made the Black and African American community invisible was something that we needed to change. And we're grateful and glad that we were able to have that conversation with the county, with our county CAO, and call that out and have that to be changed immediately on the online data for our county's strategic plan. it also gave us an opportunity to do the research, to gather the local data that we could then add to DataShare, so that our colleagues at these amazing community-based organizations and our amazing partners at the county could now have local data on the Black African American community. So with that, we launched Black Health Matters, where we now provide COVID mindful activities to connect the African American community during this time of isolation. So we host self-care Saturdays, we hosted our family barbecue, things that really speak to our culture. We learned how to do those in COVID mindful spaces. I don't know about you, but I really didn't have any intentions of going surfing. I really didn't have an interest in doing that until Bella Bonner with Blended Bridges started the Black Surf Club, and just making sure that it's not just about access, but it is about the sense of belonging. It's not that we cannot, as a Black community, access going hiking. We know where the redwoods are. We know there's a beach. But again, it is about that sense of belonging and feeling that you can be in this safe space. So with that, the next slide shows you what we worked on last fall. And that was creating the first real call out of data, a snapshot of time of the Black and African American community here in Santa Cruz County. We labeled it Making the Invisible Visible. I had a mentor who told me about 15 years ago, what gets measured gets done. When we can see the statistics, when we can see the data, it gives us that opportunity to examine what's current, and it gives us the opportunity to shine the light on what's possible. And we would have not had this opportunity had we not taken a look at DataShare to say, hey, this is the centralized location for our local data. Let's put it to use. How do we offer these programs? How do we make sure that our voice is at the table when it comes to programs and services? So this fall, the Black Health Matters initiative conducted this snapshot of time just to provide the different statistics locally. Now, this is a 4-page report that you will now be able to find on DataShare, and I believe will be put under local progress and or the resource section. In addition, we're able to take this snapshot and present it to the County of Santa Cruz, and together we can work on policy change. We can work on those systems that need to broaden its reach to make sure that all voices are heard, and that we now understand the impacts of othering. We don't want to be invisible, whether we're 2%, 1%, 60%, or 80%. We are humans. We all live, love, and work and play in this community. So we have knocked down that barrier of other, and now we are creating that space for all to enjoy and be here in Santa Cruz County. So this is how we're using DataShare, to be able to ask the right questions, to be able to have that continuous improvement for our county, and provide the data for all races and ethnicities that live, play, and work here in our beloved Santa Cruz County community. And so with that, I gladly pass it back to Eva, and I'm always here for questions. Questions or comments in the chat. Thank you so much.
Thank you so much, Keisha. I just wanted to do a follow-up. This was such a great project, and I'm so glad that DataShare was able to be helpful. What's next? What's on the horizon for United Way, Santa Cruz County, and furthering equity through data. And for those who have further questions, please put them in the chat. We'll refer to them at the end of the call for each speaker. But if you're like me and will forget your question, please put it in the chat.
Well, thank you, Eva. That was a great question. I mean, just having the snapshot of knowing how many Black and African Americans actually live here in Santa Cruz County, that was eye-opening. To learn the median income, to learn, unfortunately, to learn that we have youth who have experienced hate crimes or hurtful language to them. Now we're taking this a step further. We gave you the snapshot in the fall. Now we're going deeper. So Applied Survey Research and United Way, along with Black Health Matters, we're hosting focus groups where we're really going to capture the voice, similar to what we do with CAP, except for it won't be a telephone call. But we're going to sit with our African American community and really ask those follow-up questions, those impacts, the impacts of COVID-19 and for our community, isolation, our hopes, aspirations, dreams. Have that data available later on, late summer, early fall, so that now when our community-based organizations go on to DataShare and they start to make those infographics, they will now have data that represents, again, the Black and African American community in their demographics. And so that's what we have on the horizon, is going deeper with focus groups, capturing that voice of the Black and African American community, and then having that readily available for DataShare. In terms of an organization for United Way, it helps keep us accountable to equity. It's more than a buzzword. It's more than the catchphrase for today. But what does it truly mean to have equitable strategies in the work that we're doing as we are creating a healthy, thriving, and safe Santa Cruz for all beings? So that's what's on the table for us.
That is super exciting. I can't wait to see what information comes out of that this fall. Thank you so much, Keisha. I am going to hand it over to Nicole Young and Nicole Lezen from Core Investments, and take it away.
Okay, thanks. I hope everyone can see my screen. And I'm just going to give you a very quick tour of a couple different ways to get to some core results menu and indicator pages. So as you've heard from every speaker, in DataShare, one of the beauties of it is that there are multiple ways to get to the same destination. So some of it might just take some exploring, and we really encourage you to just get in there and start playing around with the searches and data indicators that you're most interested in, because there are so many layers to it. We can't possibly do justice to them in an hour, but we do have some time with you tomorrow through a core coffee chat if you have additional questions. So just put a plug in for that. But it really does reward time spent just trying to find your way through it. So the local progress page, which you've already heard about, has a number of things on here, as its name suggests, about things where we're making some progress locally, where you can drill down to some more data and information. But one of them is the core results menu. The core results menu is just a way that a lot of different indicators are already put together. So you can see here, these are the 8 core conditions that may be familiar to some of you who've been part of core coffee chats and other core training and technical assistance events. And I'm just showing you this because it's easy to get drilled down into our own sector. For example, I'm a public health person, so health and wellness is kind of my comfort zone. But this shows how connected all of these indicators and results areas and core conditions are to one another, going through the center part of equity here, as Keisha was talking about. So for example, just today, a random assortment of Zoom calls and meetings. I worked with some people at a school. I worked with some people on a tobacco coalition. I'm about to go meet with some people working on collaborative courts. So even in any one of our days, we are always working connected to these other sectors and other kinds of initiatives, which is a good thing. So the way that DataShare is organized, it lets you follow these trails across different sets of indicators and seeing how they're connected to one another. So let me go back to another way to get to some of these. As Sarah mentioned, in the middle of the DataShare landing page, you can see, I'll try and get myself there, these dashboards. And so these dashboards have the same information I just showed you from the core results menu without some icons, but they're all clickable. These are all community impacts that we want to achieve in each of these core conditions. But under each of these are indicators that are living in DataShare. So some of them are more filled out than others. I'm just going to show you one from the Thriving Families. Whoops, sorry. I'm on a laptop that is jumpy. I apologize. I'm going to show you one indicator in the Thriving Families core condition to illustrate how you can look at some of these indicators. So this one has, let's get this a little more centered for you. So this one shows an indicator for self-reported health and well-being, which I'm interested in, let's say, to write a grant or to put into a program plan. And I can see that for this particular indicator, I can compare it to California state's value. So California is 87.5, but we in Santa Cruz are higher than that. So that's good. I can look at other California counties. I can look at a value from the past, and I can look at a trend over time. And hovering over each of these gives me a little more information, but I want even more information about this indicator. So I'm going to click on this See More Data button. Before I do that, I just want to point out, you'll see indicators throughout DataShare that are empty, under construction, data unavailable at this time. That means that we've identified this as something people are interested in, but it's not available yet in a form that can be on DataShare, but it might be soon. And this one happens to be reports of adverse experiences during childhood, something you may have heard about as adverse childhood experiences, or ACEs. As our county and many other counties start screening for ACEs, we hope that this indicator will be populated pretty quickly and have some interesting things to offer us in terms of insights. But let's look at this self-reported health and well-being indicator a little more closely. So again, you see the information we just saw about the overall rate and its comparisons to the past and to other counties and to California overall. But you can also see exactly where this data point came from, which is the California Health Interview Survey, and when, 2019. One of the great things about DataShare is that we know that everything on here is the most current version. So we can be confident that we don't have to go look up each one to find the most recent version. This one shows a trend over time, and you can hover over any of the dots to get a little bit more detail. But what I really wanted to show you is that for some indicators, you can click on this view by subgroup and get some of the more detailed information, in this case about age, gender, and race ethnicity. That's, again, not available for every indicator, but for the ones where it is available, it can really give you some insights about any sort of disparities or equity dimensions. So for example, in this case, this self-reported general health assessment, would you describe your health as good in answer to a phone survey? The overall rate is masking some differences by race and ethnicity. These aren't particularly stark. They are in some cases, but just so you know that that's how you get to where we do have some race and ethnicity data or age and gender data. That's where it would be in this subgroup area when you drill down into the particular indicator. So You can go down a lot of rabbit holes. We all have. I'm sure we will again. And there are just so many ways to slice and dice the information that you're interested in, and to start from one point and just keep going. So if you are satisfied with the data that you're seeing, great, but you can keep scrolling down and find out even more. There's a whole database of promising practices that might be related to this indicator. So if you're trying to find something to augment a program you're already offering, or look at different ways people have evaluated something, that's a great place to start. You can see where this fits into existing local reports and plans. You can look at other indicators that are related to this one that you may or may not have thought of if you're looking to assess what you're doing or planning a new program. You can look at all kinds of fact sheets, resources, even some funding opportunities that might be related to this. So I encourage you to scroll down and click through whenever you're looking for something on DataShare. And to show you exactly how that could happen, I'm going to turn it over to Nicole Young, who will share a couple more specific examples.
Great. And what I'm going to show you is how you can use all this data that's in DataShare, use the core results menu, kind of like an actual menu and like an a la carte menu, to create dashboards that show just the data or indicators that you're interested in. And I'm not going to do like a whole tutorial about how to create those dashboards. I'm going to show you how a couple of the organizations or projects that I work with have used those dashboards to, again, track some of those data points that they're most interested in. And so right now, I'll show you a couple ways to get at this information. First, I want to go back to the core results menu that Nicole was just showing us. And if you scroll down, you'll see all of those core conditions for health and well-being and the kind of high-level impact statements that, like, what are those signs of health and well-being that we would want to look for at a community level. So you can see here all of those in kind of one view. And then the home page of DataShare, again, gives you kind of a quick and easy way to get to each of these. But if you think of this set of core conditions and the impact statements as an a la carte menu, you could basically say, oh, I'm interested in this one and this one and this one. So you can kind of pick and choose to create your dashboards. And so I'm going to show you an example using Thrive by 3 as one of our local initiatives that has basically done that. And so Thrive by 3, you'll see on this page, has also included a little description about what it is. So it's a countywide initiative that invests in evidence-based 2-generation approaches to improve outcomes for our youngest children and their families in Santa Cruz County. And this is an initiative, a collaborative that involves both public agencies and nonprofits that provide home visiting, early care and education, healthcare, pediatric care. So they're all working really closely to really build and strengthen, an integrated system of care, so that over time we see throughout our community that all babies are born healthy, that families have the resources they need to support children's optimal development, and young children live in safe, nurturing families, and children are happy, healthy, and thriving by age 3. And so what we've done in Thrive by 3, and this is an initiative that is coordinated and really managed by First 5 Santa Cruz County. And when we looked at kind of these overall broad, outcomes that we'd want to see at a community level, then we started thinking about, well, what would that look like? What are those different dimensions of health and well-being that we'd want to be keeping an eye on? And what does the data tell us about kind of the current state of health and well-being, and where there might be some gaps or differences in outcomes that lead us to look at, where in our programs, where in our systems might there be areas to strengthen and increase the coordination so that really all babies are born healthy, all families have the resources they need. And so you can see that for Thrive by 3, the kinds of indicators or data that this initiative is tracking are lined up. They match up with 4 of the core conditions for health and well-being. And each one of these has a link where you can then look at kind of a subset or small group of data points. I'm going to click on the health and wellness one so you can see what this looks like in terms of an option for how a dashboard could look. And I'm already subscribed to the newsletter, so I'm going to say no thanks. But I encourage everyone else to subscribe to the DataShare newsletter so that you get updates. But here you can see, and again, this is a dashboard specific to Thrive by 3, that under that core condition of health and wellness, there are 3, and 2 of them are kind of lumped together, long-term outcomes that we're really interested in and want to be looking at the community level data about how, how our community looks right now. So one of them is increased percentage of young mothers getting prenatal care in the first trimester, because we know that that is an early indicator of the baby's health, of future health. So we're really trying to think upstream. We want to look at decreased percentage of babies who are born preterm or born at low birth weight. So those are actually 2 different outcomes we're looking at. Because again, we know those have a great deal to do with future health and development of babies. And so here you can see that this dashboard includes a chart on mothers who receive prenatal care. And so we can see not only, the specific kind of point in time, but again, see what the trend looks like over time. And so we can see in Santa Cruz County, it's a promising trend that it looks like it's, heading upward, which is in the right direction, or the direction we want it to go. We look at preterm births. So again, this is all data that's pulled directly from the whole DataShare, database. Preterm births, a little up and down, but again, sometimes with small numbers or percentages, one preterm birth could wildly change things or make things look like they're heading in a concerning direction. So that's just one piece of information to always keep in mind as we're looking at data, like how big of a change does this truly represent? But again, we can look at things like preterm births, low birth weight, and give us a sense of, is this heading in the right direction that we'd want it to? Does it point to any other, again, programs, services, system coordination that we need to be paying attention to? So that's one example of how to use dashboards. Another example I'm going to share is from the city of Santa Cruz and their Health in All Policies work. So Health in All Policies in general, it's a name for a collaborative approach where policymakers and staff are really explicitly integrating and considering public health, equity, and sustainability as they are developing policies, implementing policies across sectors. And so there's a lot of similarities between CORE and the Health in All Policies approach, or HIAP. And the city of Santa Cruz City Council adopted Health in All Policies as a framework a couple of years ago. And so they're in the process of kind of just, figuring out how to implement that. They're still early on in their process. But one of the things that they did, that I helped them do, was really create their evaluation framework for Health in All Policies, so that anytime staff are researching or analyzing or preparing recommendations about, reports or policy proposals, things that are going to be presented to the city council, that they are applying this Health in All Policies approach or framework, and that they are looking at some key data in the community to get a sense of, again, what health and well-being currently looks like. Are there areas that need further attention? How might that influence or affect kind of the policy making? And so one of the things I did with the city was basically create these tables for them. There's one for each core condition that describes the core condition, aligns it with the community assessment project goals. So the CAP goals, the CAP being the big assessment that Keisha was talking about a moment ago, but then describing and kind of selecting, different community impact statements from that core results menu, specific indicators, and these are all linked to the specific data points in DataShare, so that for staff who may not be, going directly to DataShare every day, this gives them a quick and easy way to access that data And then all of those indicators, so we're looking right now at economic security and social mobility. All of those indicators are grouped together in a dashboard on DataShare, which is right here. So this was a dashboard I built for them, which really just, I went through and I selected indicators from the core results menu that have to do with economic security and social mobility. I wanted to be able to show Santa Cruz County data as a whole, and whenever it was available, data that was specific to Santa Cruz as a census place, so the city of Santa Cruz. And so this is the results of that dashboard. And again, it's sometimes called slightly different things in DataShare than the way we have it phrased in the core results menu. In this dashboard, it appears in a slightly different order than in the document I was just showing you, but that's just, again, it's slight differences in verbiage between DataShare and core. But you can see all the data that is available from that table is summarized here in these little cards where you can either click to learn more about that data. And so it takes you to the specific page with that data. And that's what Nicole was showing us a moment ago as an example. You can save these cards. Like if you're really interested in a specific data point, you can save that card as an image. You can, add other types of data to your dashboard if you don't want it to just be about, economic security. But this is one, again, just an example. I put together one of these for each of the 8 core conditions for the city of Santa Cruz. So lots of different ways that dashboards can be used to help focus on just the data that you are interested in. So I think at this point, I am turning it over to Jason.
Thanks, Nicole. Our role at the County Office of Education is to support educators, both school administrators, teachers, as well as parents, families, and students to support equitable practices in their school system. And part of that is, number one, the County Office of Education oversees local control accountability plans for all 10 comprehensive school districts in our county. And so I'm going to start by sharing my screen really quick of where we kind of left off on the slides and talk a little about how educators can use DataShare, number one, to open up conversations, but also number two, to build educational value in data literacy among students, staff, and administrators. And so with that, here is just one example of focus on supporting school administrators, principals, superintendents. I mentioned every single school district submits a local control accountability plan to the county office for review. But part of the process of completing a local control accountability plan, decide how schools are going to use their money each year, is done through many different family engagement sessions and conversations with school staff and all the different stakeholders in the school system specifically. And so, so some of the things that you can use on DataShare, I just put a screenshot here of one example. There's a specific hot topic as we talk about mental health, especially in the days of age of this pandemic here. We know mental health is going to be a key focus on support in our school system. And so part of the role, the schools have surveys they provide around mental health support and services, but sometimes it's better to look at other data sources as well. And this is where DataShare, because it's a community initiative, really can get buy-in for a lot of parents and families out there to utilize it as a source of data collection to present to families and parent engagements. And so, for example, from this hot topic on adolescent mental health, you can see the increase in how females are much more worse off in Santa Cruz County than those of their male counterparts, for example. And so, this data source during a family engagement meeting can drive an action in a school plan or a district plan around specific counseling for females at a school site, for example. And so using this data to drive conversations and engage parents is a key piece of how DataShare can be used at the educational level. Both at the district level as well as the school site level as well. And so again, this is directly just come from the adolescent mental health hot topic. Districts can also, principals, superintendents can also dive into this data and see comparative county data and really dive into other mental health resources. As you heard from others The related data elements are so key in utilizing this data and finding other pieces that are aligned to some of these data sources you choose. Let's look at a different group of educators. Let's look at teachers, for example. Again, I mentioned this earlier, as you heard from others. The focus of DataShare is to really use data to drive equitable conversations around our districts and our community. And you can see on this, this is a great example of how teachers can use local data to drive conversations and integrate into the curriculum itself to build a data literate community and data literate students across the across Santa Cruz County. And so this is just a screenshot of a geo-mapping of food insecurity index here. And so wouldn't it be great to actually have that conversation with students from San Lorenzo Valley, from students to Watsonville, where teachers can bring this conversation in, show them the data, and actually do some calculations and have students better understand content around numbers, around data elements. Both there's so many implications to tell a story in an English class. There's so many implications in math to calculate food insecurities, to understand geography of our entire county and our regional area. So really tying DataShare into our existing curriculum and tying it to content standards is a great way to build a data literate society. So again, there's an example of how teachers can use DataShare. And then finally, what about students? Again, different levels of students, whether they're building reports on different diseases across our county or region, or in general, maybe they're in a biology class and studying infectious diseases, pulling data from different ports of DataShare, as we saw Nicole walk us through how to build a report. There's so many implications of building reports and helping students build their own reports to tie into their more narrative-based reports they build out in each different content area they present their projects in. Like I mentioned earlier, using the hot topics is a great place to start for students and administrators, but then diving into the data. And then finally, as Nicole walked us through, it's just 3 steps to start creating a report. You click on data, you hover over interact with data, and you click on let's create report. I'm moving over here. And then there you can create a report and build out any elements you want in your report to tell a story. And this will really drive students in building out their elements of what story they want to tell with the data. So again, this can align to any one of the topics that students are studying in different content areas specifically. So lots of ways to connect DataShare to the educational environment here. Any questions around educational implications? Again, this is just kind of touching a bit of the 30,000 foot level of DataShare and education. But again, the idea is to use this to really tell stories and be able to engage conversations around our local data.
Thank you so much, Jason. It's so great to see that so many parts of our community can really leverage this data in different phases of program development or education initiatives. So it's great to have the speakers here talking about their own experience. This is the moment where if speakers have a final tidbit that they want to share about the data that they've been leveraging or about the platform in general, I invite you to unmute yourself and share any final comments. And we also invite the participants to add any questions or comments in the chat at this time, and we'll have the speakers respond directly. If you have any.
Okay, this is Keisha with United Way, and I just, as I'm looking out to over 70 people on this call, I just encourage you to go and explore. Go and explore. You received a lot of insights on how to and draw from. This is groundbreaking that we have a platform that can create our infographics. It can help tell our story. What gets measured gets done. And so I just really encourage you to get in there, explore, ask the questions. I thank Sarah Emmerich. I'm a little biased. She's my director of community impact, but ask the questions. Hey, something's not there. Ask those questions so we can make sure that things are uploaded, that we're asking the right questions to get the data up there. This tool is as useful as we as a community pour into it. So the more local data we can get in there, the best. But I just say, put on those discovery hats, get in there, pull, play, discover what's missing, and let's continue to improve this platform as we look at our work and align it with those core conditions that Nicole Young shared with us. So that's my tidbit. Let's explore, get out there.
Thank you so much, Keisha. And it's true, we just barely skimmed the surface. There's a lot of different ways to interact with the platform. And I know for a lot of the people on this call, this may be the first time seeing the platform. So understandable that new things tend to be overwhelming. So step by step, bit by bit, and we are very much available for any questions. I just want to take a minute to answer a question in the chat with the assistance of Sarah. Let me see, where was the question? So who is responsible for DataShare? So DataShare is actually, so it started a few years ago. The platform is hosted by HCI, which is a data platform that Sarah can speak to. We've had a relationship between the county and the collaborative partners for a number of years with this platform, and they do a number of the data interactions. But in terms of how we have local control over the platform, there is a collaborative of core partners, which include some of the speakers here. So United Way, the Health and Human Services, and Pajaro Valley Health Trust, and the schools are our four main partners. And we also have oversight from a community steering committee of a variety of different community partners, some of which are also on this call. So hi, steering committee members, good to see you here, and admin partners, thank you for your support and guidance with making DataShare responsible to the community. Sarah, do you want to say anything else about our partnership with HCI? That's kind of the more technical piece.
Yeah, I can kind of build off of that. So they run, I think, around 100 sites across the country, and they maintain a lot of the national or state level data. So when new data is released, they'll upload it and keep it all up to date. So that's nice, that's out of our hands. And then I keep the local data up to date. So I think there's some indicators from the CAP, there's some from the crop report, and we're still building out the local indicators, but I upload that every time new data is collected on that.
Yeah, and I also see a request here for more data and information on young children and the well-being of young children. So we are always trying to integrate more local data, like Sarah said. If there's a particular source that you found really helpful, we're aiming to work with sources that may have a varied capacity from what HCI can offer and see how we can do best integration. So thank you for Kids Count. If there's a particular set of data, please interact with us. There's actually a request for specific data on the web page. So you can go on and say, this is the kind of data that I'm looking for. And if it's on there, we can guide you to it. We will do that. And if it's not on there, we can bump it up in priority in terms of requesting that information from HCI or integrating with other platforms. I think I'm probably missing questions. So let's see. More things in the chat here.
If you see Carolyn Coleman's question.
Yeah. Sarah, do you want to respond to Carolyn? First time seeing in a long while rich data. Is there any breakdown by city or by region, North and South County, and racial ethnic categories? As Keisha said, seeing yourself, that goes for Hispanic, Latinx, Indigenous folks who in census data don't always see themselves in their distinct identities other than non-white?
Yeah, so data on DataShare is able to be disaggregated by census place, zip code, and census tract. And so if you go under, I'm going to share my screen real quick just so you can see. If you want to see like different ways that data can be disaggregated, if you go to view data and go to indicators by location level, you can see all the different ones that can be disaggregated at different levels. So just taking the first one, adults who binge drink. If you click on this and then you want to look at, you can start at an overview of the county. You can see that it can be disaggregated here by census place, zip code, census tract, and then you could also download that if you wanted to look at it in other ways or put it into Tableau or something. Yeah, and great point. So as for racial and ethnic categories, we don't have the same kind of grid where you can see, but some of the indicators are able to be broken out by ethnic group, and we're looking to supplement some of that data with local data as well. So indicators that we're collecting locally that might offer other ethnic categories that HCI doesn't support at this time.
Right, which is like, for example, you know, the Black Health Matters snapshot is so helpful in bolstering the information that the platform does provide that has that local component. Great. So we would like to put up a poll for those on the call. If you can just respond to the following questions. Take a few minutes just to think about what was helpful or could have been more helpful in this. So if you can respond to the poll, if you haven't done a Zoom poll, you can go down to the navigation bar to make your response.
And Eva, while people are responding to the poll, I just want to emphasize how much this is a work in progress. It's progressed a lot since we started, but so many things get added. You can look at the recently added indicators if you haven't been there for a while. You can find different ways, different paths into the data. We are working really hard to keep abreast of when there are opportunities to add new things, either local things or through the HCI platform. So just keep checking and keep letting us know what you're looking for, because it will get more robust over time, and a lot of data will become more easily available just in the next few months or years. So it's going to get better and better.
Yeah. Yeah, I completely agree with you, Nicole. And I think that the main reason why the platform, both our interaction with HCI and pushing them to develop and innovate, as well as our own choices on how we figure out how to make this platform most accessible, is really because of the conversations that we're able to have with the steering committee partners and the admin partners about what's important, what needs to be centered, what's missing. You know, as Keisha emphasized, those are all have been really wonderful conversations. So thank you all for being a part of those. And anyone on this call that has supported or wants to continue to support this work, please be in touch. Coming up tomorrow, we have a debrief of today's call. So if you want some more hands-on help, we have office hours with Nicole Young and Nicole Lesden. Sarah and I will also be there to support. We'll make sure you get that invite directly if you've attended the session or if you were registered. And then over the summer, we are going to do a community speaker series. We're super excited about it. This is kind of our launch of that speaker series, and we're excited to continue this conversation in the community. And next week, there is a pop-up career fair with CORE and leveraging data around careers. So thank you very much. I think we are at time. I'm just going to double check the chat and see if there's any burning questions, anything that wasn't answered in this call. We'll make sure to get to it in our follow-up. So thank you very much. And we hope to see you at the speaker series or in tomorrow's coffee chat and debrief from today.